Thank you for your call. We'll go to Jupiter. You're on Newsmakers.
Yes, I would appreciate the doctor addressing breast reduction. And once the breast reduction takes place, what is actually removed, and is there less chance of any cancer occurring? And what would the cost of that be about?
Okay. Breast reduction surgery is, as with other surgeries, a trade-off. Usually, a lady will come in with large pendulous breasts that are bothersome to her. What I mean by bothersome is either they are causing a problem with neck pain, the bra is so tight on the shoulders that they will develop permanent, almost permanent indentations of the shoulder in the strap areas, low back pain, or because the breasts are so large themselves that they may interfere with work, with physical activities, and may be painful in themselves because of the volume and weight. I think the first thing that needs to be looked at is the overall weight of the patient. We would be kidding ourselves if we said that we should operate on everything. Again, it comes back to what you are going for, hopefully, is a board-certified surgeon who has had the training and the experience to not only be able to say yes, but also to be able to say no. And when I say no, it doesn't necessarily mean no always, but if a physician looks at you and says, you know, are you trying to lose weight, or you seem to be overly heavy? If you lose weight, most ladies will recognize that one of the first places where they lose weight is in the breasts. So the first thing that I would say to a patient is, let's see what your weight is for your body size. And if you need to lose weight, let's do that first. Oftentimes that will reduce the volume of the breast for what you need. Now, if after you've gotten down to your fighting body weight, and that's where you're going to be, and there's no way you're going to change from there, then we talk about the surgery. The surgery is removal of skin, fat, and glandular structure. Depending on how large the breasts are is how then the surgery will be done, because we're then talking about whether to leave the nipple and areola attached to the underlying structure or to remove it and put it on as what we call a graft. The reasons for that is that we found if we can leave the nipple and areola attached with the blood supply, then hopefully the survival of that nipple areola will be better in the long run. Now, we've seen that, but it depends on how large the breast is. Truly large breasts, you cannot do that with. You will probably end up losing the nipple areola. The other thing about large breasts that can be problems are because of the fat and the amount of fat that's involved. A lot of it is fat, and when you remove fat tissue, the fat itself will go through a rendering process in the postoperative period where you can develop problems with drainage or infection and things of that nature. I think the third thing to discuss with the breast surgery reduction is that it is a lot of scarring, and it really is not dependent on the surgeon's skill, unfortunately, as to how good or poorly you will heal and scar, but how your own body tissue reacts, how you will form wounds. And if you think about any time that you have a scar, if there is weight and volume involved, then that scar may spread. I think the fourth thing to note about breast reduction surgery, as with everything else, is nothing is permanent. And we have seen, unfortunately, in time, and if you take a mature surgeon and you look maturely at this subject matter, that in time what was once a lifted, reduced breast may begin to show signs of sagging and may need something done in the future, but that also should be discussed before surgery. The usual cost for such a surgery, again, refers to the surgeon's fee, the facility fee in the hospital, the anesthesia. You're probably talking in the range of anywhere from $4,000 to $10,000 plus or minus.
What about, she mentioned cancer. Does it reduce your chances of cancer if you have a breast reduction?
Well, if you look at cancer as the breast tissue or the breast gland being a target organ for an immune problem of how I view breast cancer and many others view it, then if you are reducing the target organ by any amount, hopefully you are reducing the level of incidence or the spot where that cancer may go. But I think it would be a fallacy to think that by just doing a breast reduction that you are doing a procedure that will avoid or reduce your chances of cancer. There are other procedures such as subcutaneous mastectomy, or in the case of the lady that we showed at the beginning, either the modified, simple, or total mastectomies that do much more to reduce that target organ. And even with those, even with the most the radical mastectomies, which before had removed the lymph nodes in the armpit, had removed the muscle, and you had seen the skin sticking down to the rib cage, even with that, they have done the studies showing that there is still residual breast tissue that may be found underneath the ribs, in the stomach area. So I think that what we're talking about is perspective.
I'm going to ask our viewers to once again hold on the line. Those are the callers who are on the line. Please be patient. I want to go back to the slides. We have had a few men call in tonight, and actually I think men make up 15 to 20% of the plastic surgery that is being done today. You have a patient you are going to show us who has had a tummy tuck and happens to be male, and just once again I want to say that this is a graphic slide. So why don't we take a look at that, and you can explain how you do a tummy tuck.
Okay.
Now, is this someone who maybe had lost a great deal of weight, and so
this is a gentleman who is an executive and lost over 100 pounds. And I give him all the credit in the world, as with anybody who is conscientious about themselves and in trying to improve. This gentleman had gone through an exercise program, had been on a weight reduction program, and presented with this. And what we're seeing here is really two components. We're seeing an excess of skin, and we are seeing an excess of fat. And if we can have the next slide, please. This is the result after surgery. Again, there is a trade-off of the scar that is formed. Unfortunately, I do not have a magic wand, and if I had a magic wand, certainly I would use it, and I'd give it to all the surgeons that I know to use. But the trade-off with surgery is scarring, and really depends on how the individual will scar as to what type of scar will be. But what we did, if we could go back to that slide, or the next slide. Yeah, that would be good. This is the side view, or the lateral view, showing the same thing. What we did is we made the incision above the hairline of the pubic area, and we then go up between the level of the fatty tissue on top of the muscle up to the lower portion of the rib cage. And if we could go on to the next slide, please. And then we pull down, much like a window shade, as to redraping the abdomen, and the excess skin and fat that are there are then removed. We'll usually, in this case, we would redo the umbilicus or belly button. We'll take the belly button out, cut it out in a circle, and then reintroduce it at the appropriate spot after we've taken the skin and fat down, and then do our sewing.
And we'll go back to the phones now. Hello, you're on Newsmakers.
I'm interested. Dr. Barr just talked about breast reduction. I have a few more questions. He did kind of touch on what I wanted to know, but I'm more concerned about if a person did have to lose a lot of weight, let's say 50 pounds, and we're told they needed a breast reduction, but then they lose that weight and they lose a lot of breast tissue, a lot of fat, and it's just like hanging. What would he do then?
Well, I think your question is good, and there are two parts of it that I would like to address. The first is that I would not recommend that you have a breast reduction, and I don't know anybody who would do that. I think the question comes in is what you want. And the nice thing, or the important thing of this type of surgery, is that you have control. And it is your body as it is your life. And I can't be stronger in regards to this. Nobody is going to judge you or grade you or give you anything other than what you want. And as we begin to recognize this in ourselves, that this is what we want, if there is something available to help us with this, then by all means pursue it.